Look who I'm on the elevator with. 6. A robot. It just got on the elevator. Is it gonna get off? Oh wait, going to floor 6. Let's go. Okay, we're on 6. Oh my god, he didn't get off. Oh my god, I'm not even vlogging today, but I had to document that.
Couldn't have fallen for you sooner. Soon as I met you, I was tuning. All my friends shooting for our future.
My name is Lauren. I am a first year internal medicine resident physician. If you're new here, if you're not, welcome back. It has been so long since I've seen you. I've missed you. I hope you missed me. It's been a while. It's been a while. I have a lot to catch you up on. I know I look insane right now, but I thought I could take these out and we could chat a little bit before we go into the hospital together. I did a braid out and I've only done maybe one successful braid out since I started wearing my hair curly in my first year of college. Actually, no, I guess when my hair was like really damaged, I was able to do them better, but now that my hair has a personality, I just cannot really succeed at braid outs, but there's a certain texture that I'm trying to emulate. I just wrapped this around it to stretch the braid a little bit. Today I will be in the medical ICU. Today's Saturday and I started on Monday in the ICU. I did have yesterday, Friday off. Felt great at the time, but now of course I'm gonna be there the whole weekend. That like most of the hospital will not be there. I do like the hospital on weekends because it's just a little bit more quiet and not super busy. We have so much to discuss. It is my 4th month of residency now. I have been a resident for 4 months, a practicing doctor for 4 months, and that means we are almost a third of the way done the year, which is insane. I feel like I know some things, but I also feel like I still don't know a lot. Of course, I'm still learning so much. Okay, I'm looking at the camera, so I really like don't know what this is looking like, but I feel like I'm not gonna like it. It's my first impression. What else do we have to talk about? I had all these things I wanted to say, and now I'm like camera shy. What else do we have to talk about? I put a little mascara on for you today, so I could look cute for you. I like my program, which I knew I would. If you've been following along for a while, you would know I kind of, I don't want to say struggled. No, honestly, I did struggle a bit with like, not the program that I matched to because I knew that would be great, but the city that I'm in, which is Cleveland. Freaking Cleveland. And as far as how much I'm liking Cleveland, I like it. Like, it's okay. I don't know if I will stay here forever in this moment. Like, that's how I'm feeling. However, dude, like, why? Oh, as far as me matching here and why I think I matched here, I think one of the reasons was my co-interns. I love them so much. I have made some amazing friends already that I see pretty much every week, and like maybe they were my reason to meet the people that I've met, who I'm sure you will meet one day. I actually have not told anyone that I do this. I mean, I haven't even been doing it that often because I wanted to film less while I'm still working on my backlog. So I want to like film things more in real time. I'm only filming today because I wanted to like definitely have a video for my first time in the ICU as a physician. Oh, it's so early to talk about medical stuff. It's like 5:30. I have to be in the hospital in the ICU at 6:30 a.m. for sign out. And that's when the overnight person tells me about all the patients, like my patients. However, as I said, today is Saturday. I had yesterday off, so I was not there yesterday. So I have to do a bit of catch up today and see what happened the day that I was gone. And then there's 3 interns in the ICU. Someone's off Friday, someone's off Saturday, someone's off Sunday. And my understanding is that once one of us is off, the other interns cross cover and take their patients. I was at 3 on Friday, but then one of my patients left, so I'm at 2. I think it'll be a hard morning as far as trying to figure out everything that happened and preparing to present at 8:30. 2 hours might seem like a lot of time for you. It might seem like a little bit of time. I don't know. This is how it's looking. I don't like it, guys. I don't like it. I don't like it. I think I just have to give up on braid outs. I just feel like it'll never work. I also did use Pattern Beauty for the first time. but it's like, it'll just never be what I want it to be. My medical school program, we would start rounding at 10:30. Like if an attending wanted to round at 9:30, it was a bit early, but we would obviously do whatever the attending wanted to do. Here we round at 8. We rounded 8 on the floor, and in the ICU, luckily we rounded at 8:30, which actually makes a huge difference. But yeah, on the floor it's 8 o'clock. We don't play around here, which coming from a place we run at 10, even though I don't know, I guess 10 was a lot of time. I think the last time you saw me was in the night shift. So since the night shift, I did my first ambulatory block, which is like outpatient. I became some lucky people's primary care physician. I'm someone's PCP, which is interesting. After that, I was on vacation for 2 weeks. I went to Virginia Beach, which my family has a timeshare there. We go there every year, but I personally have not been able to go the past like 4 years. So I went there. I saw my parents for the first time since moving here. I haven't seen them in so long. I told my mom I was coming, but I didn't tell my dad, so I surprised him, which he actually was like not happy about. He wished he knew. So much drama with that, but like funny drama. He's so funny. Then after that I came back. I did inpatient. I was on an infectious disease team, like primary infectious disease team. If any patient comes into the hospital and they have HIV, they go on that team regardless of why they're at the hospital. And then there was also some active infections. One of my patients had candida, which is a fungus in the blood, and now I'm in the ICU. And since I've been in the ICU, the most interesting patient I had, it was a very unfortunate case. She had stage 4 breast cancer. The breast cancer started causing a fungating mass or fungating wound, which I had never even heard of before, like the word fungating. If you're in medicine or you're not, but you're interested, go on Google and type in fungating breast mass, and I'm sure something of what I'm talking about will pop up. This wound was so severe, you could see all the layers of her skin. You could see the adipose tissue. It was so severe. Obviously it was so painful. Wait, I actually might like my hair. But how's the back look? Is it bad? Is there a part? Oh, I hate that. Because the wound was so, or like the layers of the skin were exposed, what does that cause? I'm sure many of you have said infections, and the patient was getting recurrent Pseudomonas infections. So we were kind of like working them up for sepsis. They also had mets to the lung. Very, very sad at this point. I don't know that there's much that can be done, but that's the patient that left the ICU on Friday because she just didn't have any more ICU needs. But that was like probably the most interesting thing that I have seen since being in the ICU. My current patients in the ICU, one came to the ICU for hypotension, was on pressors, now off pressors. They have like an air leak in their lung. They have a little chest tube called a pigtail. I'm sorry I'm like going through this fast, but I need to like move on. And they were gonna get an endobronchial valve to plug the air leak. And my other patient, also a very sad, poor outcome case, decompensated cirrhosis, led to multi-organ failure and shock. The liver is failing, the kidneys are failing. Patient is oliguric, which means they're like barely urinating, which is a very like poor sign. They cannot get dialysis because they're not a candidate. So yeah, they're also encephalopathic, they're not speaking. We had to put an NG tube down because they're not eating. They're too sleepy because they're on pain medication because they had a questionable soft tissue gas in their arm, but they're not a surgical candidate. Very sad, poor outcome. A lot of like speaking to the family, figuring out where we go from here, goals of care. I had one day where I did have to do chest compressions on a patient that did not make it. However, it was the patient of the other team in the ICU. But of course we all help out for codes, and I did have to do chest compressions. Guys, how bad is the back? Is the back better? Is it better? I hope. I don't know. I like need to look at it, but I also don't want to look, you know what I mean? Like I kind of just don't want it to be my problem. I'm gonna do my edges really quick and then eat breakfast and have the door menu with me. Oh my god, I've been talking for like 15 minutes. but we had a lot to catch up on. Now we're gonna get moving. Oh, also, tell me how you're doing, please. Give me your life updates. Are you still in med school or a different type of school? Have you graduated? Are you also in residency? Are you studying for something? Did you suddenly get engaged? Because everyone has gotten engaged this year. Like, what's going on with you? Please let me know. My children don't want me to leave. Very, very sad. They're like the hardest goodbye every single morning. I just got to the hospital, 6:17. It's a 12-hour shift. So I sign in at 6:30 and then I sign out at 6:30 p.m., a.m. to p.m. I didn't have time to eat breakfast. It's okay. I have naked juice. Like, that is my girl, honestly. But let's go and hopefully it is a great day. I will film what I can, but it's the ICU. There's so many people in there, so we'll see what I can do. That has happened is my birthday was last weekend. I severely sprained my ankle rock climbing, which is honestly hilarious and a story that I'll tell you later. And today's my first day not wearing my brace on my ankle, so we'll see how walking rounds goes. I just finished pre-rounding at 7:30. I'm now gonna go to the computer, type everything in my notes, because I present from my notes. All my patients from before are gone, except the one who had like a really poor outcome. They are now hospice, so they were passed off to the NP here. So I have 2 new patients. One is new to being in it, one is new to me, but has been here for a day. It's hard like figuring out everything that's going on. We have a new patient, especially if you didn't like admit them. So a bit of a learning curve, but we have an hour to prepare 4 rounds. Rounds are done, they went well. For the first time, we are going to get coffee at the Starbucks. I think our whole team was just kind of in the mood for it, so I said that I would go, honestly, so I could vlog. But it will be nice to get fresh air, so I'm walking across the street to pick up the drinks. It is such a beautiful day, oh my god. This is nice, honestly, like I needed this. But as far as what I saw today, so far, my 2 new patients, one of them is having tongue swelling, caused their airway to be compromised, and they have a nasotracheal intubation right now. So like through the nose and down into the trachea. Never saw that before this rotation. So if you don't know, Cleveland gets super cold in the winter, very snowy. I love the snow because I don't shovel it, obviously, but I'm worried about seasonal depression, seasonal sadness, whatever you want to call it. So I was trying to figure out how I could enjoy fall and winter more because I am a summer person, warm weather person. So I've really been trying to incorporate little ways to romanticize fall and winter. I know some people love this time of year, I just don't. So anyways, I said all that to say, I'm trying a fall drink today. I have this one, which is like cinnamon dolce or something. That will probably be the last time I see the sun today, which is unfortunate. Because by the time I leave here, it's like going down or down. What else was I gonna say about my patient? My other one doesn't really need to be in the NICU, but they're encephalopathic, maybe from sepsis, maybe from high ammonia levels in their blood, so we're working them up. We might do an LP on them today, lumbar puncture, we'll see. I've never actually seen one before. It's 12:30, I just just got an admission for paralyzed vocal cords. So I'm gonna go snap. Alright, this is long with Mickey Blue. Okay, thank you so much. Lauren Smith. Yep, you too. I'm leaving the hospital, thank God. I'm ready to go. Okay, listen, the ICU is really playing me because every day I'm so oily, but only here. I was home all day yesterday, I didn't get like this. Why do we look like this? What air is in the ICU that's causing this? I look wet. I'm in the car, the work day is done, thank God. I actually had a good day today. I have been having like more good days than not good days in the ICU, which I'm really grateful for. I love the moment where I can take this off. And now I'm not a doctor anymore, I'm just a girl. Just kidding. That portion of my brain is never turned off, unfortunately. I think I told you about all the patients that I saw. I ended up having 3 today. I haven't lost a patient yet as a physician. Obviously, of course, I lost a couple as a med student, which if you've seen the ICU vlogs of med student, I was rewatching one of them to prepare for this rotation. And I was like, wow, that was really like hard rotation. It's time to do my favorite thing, which is go home. I'm so excited to go home. Some of the vlogs I want to like just stop it once I leave work, because I think that's mostly what you guys care about. But today I'm going to keep vlogging when I get home a little bit longer, because I want you to see what it's like to have a 12-hour work day and how much time I actually have to myself when I get home, which is, spoiler alert, not a lot of time. So let's go home. I can't wait to see my babies. Where are my children? Oh, there's one. Hi. Baby. Hi, babe. There's the other. Hi, Cheeky.
You on the phone?
No. Hi, the cheek. You gonna be seen? Okay, well, there's the feet of my man. It's 7:23. Okay. Technically shift done at 6:30. But obviously it takes time to sign out and then leave. The first thing I always do when I get home from the hospital is shower. So I'm gonna do that. By the way, I don't like the hair. And I just feel like I'm never gonna like it. However, I think I could have done a better job at separating it. I was just kind of in a rush today. So maybe if I just take the time to separate it a little more, I'll like it a little better. It's too close to my natural texture to really pretend that doing a braid out is worth it, to be honest with you. I don't know, I'm giving up on braid outs, I think, for the rest of my life. So now we take everything off, take my jewelry off, and I'm gonna shower. And then, one of the best parts of my day, once I'm clean, is the food I will eat. Also, I didn't fill my water bottle this morning, and I had about 3 sips left in my water bottle, like the one that I bring to the hospital. And every time I went to try to drink out of it, and then I remembered it was empty, something would then happen that I would have to do, so I never got to fill it up. So I honestly am not drinking any water today, which is so sad. And I'm a huge water drinker, so. Okay, I feel so dehydrated. I also didn't eat anything, which, you know, vibes. I drank some naked juice, that was about it. So let's get clean and move on to the next part of our day. Okay, I'm showered, I'm clean, and it's time to eat now. It is currently 8:05. I did like take a nice slow shower. I shaved. Like, I didn't rush it today. So usually around this time, when I go to eat dinner, Andrew has already eaten, and I just eat by myself. But because it's Saturday and he's staying up late, we're gonna eat together. We need more light in here. We need more light. I used yesterday this bad boy. This is an Instapot. It's a birthday gift from my beautiful mother. And I made something so yummy. And I've been thinking about this all day. I basically made like the viral feta tomato pasta. However, I made it once before and I switched out the feta for Boursin cheese. And then I added some arugula and spinach for a vegetable. And so it's kind of not the viral pasta anymore. It's more so like a Tuscan shrimp pasta because my protein is shrimp. But it's so good. It doesn't look as good right now, like not heated up, but I'm gonna show you once it's heated up. And we are watching, what are we watching, Andrew?
Perfect Match.
Perfect Match, season 3, finale. Did you have fell asleep during this?
Oh, we just turned it off. You were like,
Oh, right.
Be like for Louis and I, especially with him. I can actually have a genuine.
I done some messed up. Like, it was like for me saying like.
Do you think when he's saying this, he means it? So it's what time? 9:22. I finished eating. I brushed my teeth, and usually I would go to sleep right now. However, it's Saturday night, and I want to enjoy my Saturday night a little bit. Sorry, I'm like trying to fix my blanket, and we are in the lobby about to get on the bus. I want to play Fortnite with Andrew just for like 30 minutes and then I will go to sleep, and I should still get like a good amount of hours. So that is what I'm doing instead of being responsible and going to sleep. And we're now on the bus. Eeny?
yeah, who's eating, baby?
Should I land somewhere else?
No, we're gonna make it. I'm just gonna be like, I'm just gonna have to run a little bit.
Ghetto.
Uh-oh, footsteps.
No. Locked and loaded.
Wow.
No! No!
Wow.
Stop. Oh my god, there's someone else. I'm running.
She's
She's
gonna-
running after me! Oh my god.
Look at the place we played. Look at the place we played.
Why was she so obsessed?
Dude, I don't know. It's right here.
I know.
You don't want it?
Overstimulated. I'm coming. Okay, I definitely played one extra game than I should have. So it's 10:27, but I'm in the bed, about to get under the covers and go to sleep. I am gonna do Duolingo, but aside from that, I can close my eyes. I'm very tired. I can't wait to sleep. Usually I would have went to bed like 30 to 45 to an hour minutes ago, but yeah, as I said, I just like, sometimes you kind of have to decide, do I want to get more sleep or do I want to choose myself separate from the amount of sleep I need and like just do whatever. I hope you enjoyed the video. If you liked the video, then like the video, give me a thumbs up, subscribe if you haven't already subscribed, and I will see you in the very next one. Bye.
I'll be giving all my love to you.